COVID-19 pandemic and associated restrictions led to a shortage of blood in the country. According to the Minister of Health, Dr. Jane Ruth Acheng, who was today appearing before the Health Committee of Parliament, the country has not experienced a serious shortage of blood yet.
Managing the demand for blood, UBTS continuously assesses blood stocks in hospitals using blood accountability forms and has continued to appeal to the general public in the communities for blood donor mobilization. So far, the country has not experienced a serious crisis.
However, a visit to Mengo Hospital Rotary Blood Bank indicates that there is a big shortage. There are few reliable figures to quantify how bad the situation is, but the supply is not meeting the demand across the country. The main modes of blood collection in Uganda involve school visits, community blood drives, or donations from donor clubs. These methods are not applicable in the current environment where all schools are closed and mass gathering of people are discouraged or even prohibited.
But generally speaking, there is a very big shortage of blood, as you can imagine, because our routine donors mostly are institutional, students in colleges, in high schools, and now they are back home. What we have tried to do is to locate our donors from our systems. You know, we trace them. We trace our donors in the systems and we call them up. So then we go visit, we go pick them from their areas of residence. But we prefer, at least when we call you, mobilize also.
This new strategy has increased the costs of operation of the Uganda Blood Transfusion Services.
Moving direct to the villages to collect blood, mobilizing the blood donors, and transporting blood to the facilities during the lockdown. So UBTS requires additional funding to meet the increased costs.
The new normal in blood collection will require 20.5 billion shillings that will cover establishing call centers, hiring community resource mobilization persons, publicity, recruitment of volunteers, vehicles, medical supplies, personal protective equipment, and other additional field equipment. But concerns have been raised about the costs of personal protective equipment.
When we look at this particular budget, which is talking about the PPEs, with a total of 493 million, 450,000. And we are talking about masks, gloves, washing soap, sanitizer, water dispenser, buckets, and all that. Are these additional, or this was never planned for?
Rita Kanya, NTV.